When a doctor loses his career for discussing which treatment plan might best serve patients, there's something very wrong. But that's exactly the state of things in American medicine, where a well-respected leader in his field, like Dr. Allan Josephson, lost his career in the blink of an eye just for expressing his scientifically grounded concerns about current trends in treating gender dysphoria in children. My name is Christiana Kiefer. I serve as Senior Counsel for Alliance Defending Freedom, where my colleagues and I advocate for clients, including Dr. Josephson. Dr. Josephson is a board-certified psychiatrist and scholar. After spearheading the Division of Child and Adolescent Psychiatry at the University of Louisville for almost 15 years, he was punished because on-campus activists were outraged that he publicly shared some of his views on how to best care for children experiencing gender dysphoria, views he developed over 35 years of working as a psychiatrist. On a panel hosted by the Heritage Foundation, Dr. Josephson encouraged medical professionals to understand and treat underlying psychological issues in children experiencing gender dysphoria, instead of rushing to prescribe puberty-blocking drugs and cross-sex hormones, life-altering interventions that do not address underlying sources of distress. In late 2017, just weeks after that presentation, Dr. Josephson was demoted. In 2019, he was fired. But his courage has been contagious, and more doctors, detransitioners, public figures, and even a small sample from within the gender clinic industry have joined him in calling attention to the real and lasting harm being done to children by replacing medically and scientifically informed treatment with an activist-driven agenda. As Dr. Josephson pointed out on the panel, studies have shown that other psychological issues like autism, personality disorders, trauma from abuse, and depression often coexist with or even predate the gender dysphoria. Rushing to a social transition, or worse yet, invasive hormonal interventions without first addressing these underlying issues is like amputating the leg of someone with a broken toe. The reality is that 80 to 95% of children who experience gender dysphoria come to terms with their biological sex naturally. Taking an approach known as watchful waiting, which allows them to experience natural puberty, these children come to accept their bodies and avoid extremes like expensive surgeries, sterility, and a lifetime of dependence on drugs and hormones. The reverse is also true. Children who are treated as a gender that does not correspond to their sex, a process known as social transitioning, are far less likely to reconcile their feelings of discomfort. As one study reported, fewer than 20% of boys who engaged in a partial or complete social transition before puberty had desisted when surveyed at age 15 or older. That's nothing to say of the negative outcomes for children who are rushed into far more invasive chemical and surgical regimens. Meanwhile, we're seeing a sharp rise in the number of American youth ages 6 to 17 who say they identify as the opposite sex or as non-binary. This growing population of gender-confused adolescents is nearly double what it was just 5 years ago. That spike comes amidst a global and national debate around the correct standard of care for the treatment of gender dysphoria in minors. Despite claims from activists, invasive hormonal interventions like puberty blockers and cross-sex hormones are not proven to improve mental health. But there is evidence of permanent physical damage, including damage to brain development, greater risk of disease, and sterilization. Recognizing the failure of these invasive, poorly researched procedures to achieve improved outcomes and the harms and risks they carry, countries such as Sweden, Finland, and England have made a clear U-turn away from some or all of these destructive protocols. After thoroughly reviewing the reliable evidence, these countries concluded that the risks of hormones and surgery are too grave to allow their continued widespread use in children with gender dysphoria. Instead, they are returning to the approach Dr. Josephson advocated in 2017 which relies on psychological and psychiatric care as the starting point for addressing gender confusion in children. The United States should follow suit, and that means rejecting the cancellation and censorship of medical professionals who challenge a newly formed yet poorly supported orthodoxy. That's not medicine, it's politics. And it's another reminder of just how intertwined our freedoms are. If we don't have the freedom to speak, to robustly debate important issues, we're all exposed to far greater harms, starting with the most vulnerable among us.